In your profession, you can face many situations that could potentially cause you to come in contact with blood or body fluids from other individuals. Whether it's removing trash that contains a used syringe, handling laundry soiled with blood, or simply cleaning up after a sick child, the precautions you follow for handling these procedures could mean preventing serious illness or even death. That's why OSHA, the Occupational Safety and Health Administration, has developed the Bloodborne Pathogen Standard to provide guidelines that will help you eliminate or at least reduce your exposure to HBV, HIV, and other bloodborne pathogens while in the workplace. Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. Most occupational exposure to bloodborne pathogens occurs when the pathogen comes in contact with the employee's mucous membranes, like the nose or mouth, or breaks in the skin, like needle sticks, human bites, cuts, or abrasions. Body fluids such as blood, vomit, and in some instances saliva can potentially contain bloodborne pathogens. But you can easily protect yourself from coming into contact with the fluids by following universal precautions. The Centers for Disease Control and Prevention established the Universal Precaution Approach, recommending that blood and certain body fluids from all patients be considered potentially infectious, and that infection control precautions be taken to minimize the risk of exposure. This is the approach taken by OSHA in the Bloodborne Standard. This means that at all times assume that all blood and most body fluids are contaminated with bloodborne pathogens, and that you should follow proper protective practices when having to handle a cleanup or an exposure. Take measures to increase safety through protective practices. Always wear the right protective equipment for the job. There are many principles to follow when doing daily cleaning tasks that will increase your safety. Remember the following safe practices. Never eat, drink, smoke, or apply lip balm in areas where there's a possibility that you could be exposed to blood or other body fluids. When removing trash, never compress bags in case sharp objects or needles may be hidden inside. When cleaning a spillage, carefully clean up and dispose of the fluids or contaminants in a way that won't cause splashing or spattering. Never reuse the sponge or towel that was used for infectious cleanup. Use tongs or other mechanical means to pick up sharp objects that may be contaminated with bloodborne pathogens or could puncture your skin. Handle contaminated laundry as little as possible with a minimum of agitation. Bag the laundry at the location where it was used, but do not sort or rinse it there. Besides protecting yourself, you are responsible for containing the bloodborne pathogens and decontaminating the area so someone else isn't exposed. It is crucial to clean and disinfect the area with the appropriate disinfectant cleaner. Thoroughly wash your hands with a hand cleaner such as Betco's Winning Hands Premium Antibacterial Hand Cleaner immediately after you remove the gloves, goggles, or other personal protective equipment. Good hand washing helps reduce the spread of infection and disease. All containers and cleaning equipment, such as mop buckets and tongs used during decontamination, must be disinfected following use. If there is any chance that you've been exposed to bloodborne pathogens, contact your supervisor immediately for specific instructions on exposure protocol. Also, notify your physician. Once an exposure occurs, be sure to pay attention to your health and watch for any symptoms that are related to HIV or HBV. Always take universal precautions when there's a chance you could be exposed to bloodborne pathogens. Remember these protective practices when you're facing bloodborne pathogen concerns. Always wear personal protective equipment. Never eat, drink, smoke, or apply lip balm on areas in which there's a possibility of bloodborne pathogen exposure. Never manually compress trash. Avoid splashing or spattering when cleaning up. Never reuse towels or sponges. Use spatulas, absorbents, or tongs for cleanup when possible. Handle contaminated laundry cautiously. Use properly labeled or color-coded containers and bags when disposing of or transporting materials contaminated with bloodborne pathogens. This includes gloves, laundry, and equipment. Always decontaminate surfaces and/or areas with Betco Quatstat or TB Plus or other appropriate disinfectants. Always properly wash your hands. Disinfect equipment and materials used for cleanup. Contact your supervisor and physician immediately. If you need more information, ask your supervisor or check out the OSHA website at www.osha.gov.